Assalamu alaikum wa rahmatullah. I'm Dr. Kinan. I'm a specialist in pulmonary diseases. I work in Zuleika Hospital, Sharjah. Today we are going to talk about respiratory tract infections in Down syndrome. Respiratory tract infections are very important because they are very common in all countries worldwide. And unfortunately, both adults and the children with Down syndrome are more likely to develop respiratory infections and require treatment and admission to hospitals and longer stay in hospitals compared with other individuals. It's estimated that among young children with Down syndrome, that respiratory tract infections are responsible for approximately 30% of all hospital admissions. If we take all admissions for a group of Down syndrome individuals, for example, for 1 year, we will find that 30% of these admissions were because of respiratory tract infections. Respiratory tract infections are the second leading cause of death in children under 18 years, not only Down syndrome children, in all children in general. That's why it's very important to prevent respiratory tract infections and to treat these infections as early as possible. We can divide the respiratory tract infections into two main groups: upper respiratory tract infections and lower respiratory tract infections. Upper infections include common cold, pharyngitis, sinusitis, tonsillitis, and ear infections. Lower respiratory tract infections include bronchitis and pneumonia. Respiratory tract infections can be caused by so many types of microbes, but mainly by viruses. Why respiratory tract infections are more common in individuals with Down syndrome? For so many reasons. Because Down syndrome individuals, they have narrower upper airways than others. They have structural differences in the lower respiratory tract and within the lung tissue itself also. They have lower muscle tone than others, which is responsible to be or to have more likelihood to develop infections. And they have higher prevalence of obesity, and they have differences in their immune system. And most of them, they are more likely to have other health problems like heart diseases and other diseases. Now, how to decrease the likelihood and severity of respiratory tract infections in Down syndrome individuals? Very important steps we should follow to decrease these infections: vaccinations, keeping good hygiene and infection control, keeping healthy environment, maintaining good general health, avoiding contact with sick people, and asking for medical advice for any respiratory symptoms. The first one is vaccinations. Vaccinations are very important and the most effective way to prevent from infections and from developing serious infections and complications of these infections. Two essential vaccinations should be considered for all individuals with Down syndrome. First one is influenza vaccine. The second one is pneumococcal vaccine. And nowadays, COVID vaccine, because for the current situation as well. Influenza vaccine, this vaccine is now routinely given to all children aged 2 to 6 years old. It should be considered in all individuals with Down syndrome young and adult after the age of 6 months. This vaccine is a yearly vaccine given usually from October every year. Pneumococcal vaccine. This vaccine can prevent from infections caused by Streptococcus pneumonia. It's part of the national vaccination program in United Arab Emirates for all children. But another vaccine advised for all individuals with Down syndrome over the age of 2 years. COVID-19 vaccine, it's advised now also for all individuals, but age categories depends on the type of the vaccine. Some vaccines are allowed from the age of 3 years. The second point is keeping good hygiene and infection control. We know that bacteria and viruses and microbes are everywhere around us, and it is it's impossible to avoid contact with any bacteria or viruses around us. So it's advised to maintain basic hygiene to reduce the chances of infection. This hygiene includes proper hand washing after contact with sick individual, and after food also, after using the washroom, and avoiding sharing of personal items with others, and avoiding putting hands or unclean objects into the mouth. All of these procedures will help to reduce the chance of respiratory infections. The third point is healthy environment. Healthy environment is very important to decrease the respiratory infections. And it includes that we should maintain a healthy home environment, which means warm and dry environment, and to try to avoid areas of excessive air pollution as much as possible. Why we should keep warm and dry environment? Because damp and cold and moldy air, moldy environments and air polluted environments can cause or exacerbate existing respiratory conditions, especially asthma, and can cause more severe respiratory infection symptoms. The fourth step is maintaining good general health. It's very important to keep good general health for Down syndrome individuals, because it will increase the body immunity and make it easier to fight the infections. And this includes regular exercises and having a balanced, healthy diet, and avoiding harmful habits like smoking and alcohol and weight loss. It's very important to remember that smoking, passive or active smoking, is known to predispose to respiratory infections and increase the severity of the symptoms of these infections also. Number 5, avoiding contact with sick people. It's very essential to avoid contact with sick people, especially those who are admitted in hospitals or those who are known to have highly contagious infections. Then last, asking for medical advice for any respiratory symptoms, because the respiratory infections in Down syndrome individuals can be more severe and have more complications. So it is very important to remember to ask for medical opinion at the earliest for respiratory infections. And also, we should keep in our mind that to ask for medical help in case of unusual persistent respiratory symptoms, like cough if it lasts more than 6 weeks, fever if it lasts more than 5 days, or if we have weight, appetite loss, night sweating, or cyanosis. All of these symptoms, we should consult the doctor as soon as possible. Thank you for listening. Assalamu alaikum.